Hi, this is Team Otter Be Amazing, presenting on the case study Raul Ramirez, Designing Educational Materials for a Neurodiverse Patient Population. In this case study, Raul Ramirez is a newly hired nurse educator. Nurse educators provide health educational materials and discharge instructions for patients and support nursing and specialist staff in delivering discharge instructions. Years of patient feedback survey data showed that neurodivergent patients were less satisfied than neurotypical patients in how they received their discharge instructions and had more difficulty adhering to traditional aftercare instructions. This nurse educators team has been tasked with designing more inclusive materials to improve the experience and health outcomes for neurodivergent patients. In this case, there were four significant constraints in designing an instructional solution. Infrastructure, due to limited connectivity and technology that can hinder solutions like video and VR-based education. Budget, with insufficient funding restricting technology upgrades and alternative training resources and existing grants expiring soon. Time constraints, due to understaffing and competing priorities. And buy-in, due to staff reluctance to adopt new methods. These barriers could limit the effectiveness of new materials. Limited funding and time mean the team cannot rely on more costly tech solutions, and as staff are spread thin due to COVID-19 and reassignments, new ideas must be easy to create and implement. As some departments have niche training methods specific to their patients, the team could focus their efforts on a review of areas with highly dissatisfied patients. As they need to account for possible resistance to change, the nurse educator could also include training pertinent to the staff to help them understand the importance of alternate instructional material and its effectiveness in garnering their buy-in and overcoming learning curve challenges. Universal Design for Learning, UDL, principles have proven essential in addressing the needs of patients with neurodivergence, particularly through strategies like multimodal delivery, repetition, and chunking. These methods cater to varied processing needs, enhance information retention, and prevent cognitive overload. For instance, Raul's consultations with medical staff emphasized the value of clear, concise messaging, a prime example of effective chunking. By breaking down information into manageable, focused pieces, staff can support patients' understanding without overwhelming them. Combining these chunked messages with multimodal delivery, such as visual aids and hands-on demonstrations, offers a robust approach to meeting the diverse learning needs of neurodivergent patients and reinforces UDL's potential to enhance patient education across the board. Given the constraints in our analysis and the design elements we need to include to serve our neurodivergent patients, this table shows the range of alternative solutions to support our design solutions. For instance, job aids and visual aids allow multimodal delivery while allowing the option to spread discharge instructions over multiple visits, ensuring the patient can process the information at their own pace. We believe that a rapid prototype in a single department is the best proposed solution for testing materials in a controlled way. Choosing a single department and identifying a subject matter expert allows the nurse educator team to field test some basic UDL practices with the staff and patients while garnering support in a department. Among the alternative instructional solutions, we chose visual aids, clear scripts, and audio recordings for patients, which provide accessible information without high-tech environments, as the solution for this case study. This low-cost solution can be implemented quickly with little training required. It is designed to be inclusive and thus beneficial for neurodivergent patients and simple enough for staff to adopt. This aligns well with both constraints and current needs. Since our solution is a rapid prototype, the goal is to quickly get an instructional solution into the hands of one department and then evaluate its effectiveness. Our evaluation will focus on three areas: patient and staff feedback and health outcomes, such as readmission rates. When possible, Raul's team would compare these data for neurodivergent and neurotypical patients and use longitudinal data for recurring patients to see if their satisfaction or health outcomes have improved during the prototype period compared to prior hospital admissions. They can adjust the materials to meet needs better as they gather feedback. Success in areas will help garner support and interest from staff in other departments, making it easier to expand the program. If the data shows improvements, Raul's team can use that information to apply for additional funding.
Thank you for checking out this case review from CSUMB MIST program, Team 9, Raul Ramirez, Designing Educational Materials for a Neurodiverse Patient Population, from the ID Casebook, 6th edition by Hawks and Jones.